Okay, on to our next form of electrical stimulation, which is by far the most common ones that we're going to use, and that's what's called transcutaneous electrical stimulation, or TENS. TENS tends to get attached to TENS units, which are portable devices that allow us to do some of these different pain relief techniques. However, TENS is really more of a philosophy of pain control. Um, and so we can do it on our larger machines as well as on a TENS unit. We're going to be using a biphasic waveform when we use our TENS on the machines in the athletic training room. So TENS stimulation, again, using the biphasic waveform, is a type of an AC stimulation. So again, there's no true positive or negative pole. The nice thing about the portable TENS units is obviously they allow individuals to have pain relief outside of treatment time. And so they're really the chance for someone post-surgery or in a recovery to have some pain relief that is maybe not medication-based, which in today's society, with all the issues with opiate addiction and things like that, it's nice to have some alternatives that could potentially be available to them. So talking about TENS, it's a current applied across the skin, which is really all of our TENS unless you have, or all of our E-stim unless you have implantable electrodes. But again, it has kind of turned into this idea that TENS describes the pain relief aspects of E-stim. So it can encompass many different forms. Again, when we're talking TENS, we're going to most likely be talking biphasic waveforms. But the philosophies that we talk about, the pain treatments, can also be done with our high volt. We'll talk about it with IFC and pre-mod as well. So we're going to mainly right now focus on, again, using that biphasic waveform. So looking at the effects for TENS, it's mainly afferent nerve stimulation. And so we're trying to target either A beta, A delta, and some A alphas, which are our motor stimulations, or C fibers. So based on how we set our parameters, we can get the different levels of pain control. So review back to chapter 2 when we were talking our different levels of pain control. So we had our ascending, this was our gate theory, where the level 1, where we were trying to stimulate those A betas to essentially close the gate and block the sensation of the A deltas and the Cs. We have our level 2, which was targeting our C fibers. So this was kind of our pain inhibits pain, so our central biasing, in order to get the relief in the spinal cord itself. And then we had our level 3, which was our endogenous opiate release, or our beta endorphin modulation. And that's where we're targeting the low frequency motor stimulation, mainly A deltas. The A alphas, our motor stimulation, also kind of come along for the ride here. And we target for that beta endorphin release that then goes through the bloodstream. And so we tend to get longer pain relief with these two mechanisms than we do with the level 1, which is really only during the treatment. So the effects are basically based on pain relief. And so the parameters help us set which type of pain relief we can target. Advantages, there's portability if you have the portable TENS units. It can be an alternative to cold for pain relief, especially during a technique that we call cryokinetics, which is the use of pain blocking to then be able to start exercise sooner. So again, we could potentially use TENS for that instead of the cold, and it's an alternative for medications for pain relief as well. Disadvantages, we're looking at the fact that this is all just pain modulation. We are doing nothing to actually help the tissue recover. And so TENS should be used in concordance with other things, especially exercise, right? Our number 1 modality. By using the TENS, we can help promote the healing process, because remember the pain spasm cycle. So if we remove the pain, we can hopefully help reduce the spasming that's happening in the area, which would then allow the area to be more likely to be able to progress through the inflammatory and proliferation and maturation phases. But using TENS without a really good diagnosis and without doing other things could really just mask a more serious problem. So we want to make sure we always do our due diligence ahead of time. People can start to rely on it as a cure-all because it solves the pain, which is the main reason they came to see you. But again, it's not necessarily working on actually targeting the tissue that we need to for healing and recovery. So our indications are going to be pain. Mainly pain, either acute, subacute, or chronic, and the different levels that we talk about are going to be the different areas to be able to target. Again, with that, we can get some other side effects, potentially some edema reduction, potentially, again, the decreased muscle spasms and things like that, but they're all secondary to the pain relief, so that becomes the main indication. Contraindications are all of our typical stim contraindications, the implanted pacemakers, cancers, pregnancy over the lumbar abdomen area, over the heart and the brain, especially those sensitive areas like the carotid sinus and the pharynx and the larynx and all of that. Any myocardial problems. So basically our general contraindications. Precautions, again, impaired sensation. If there's any skin lesions, we want to be careful not to put the pads directly over that. If they're wearing the device on their own as a portability, we don't want them working like driving a car or operating machinery, because if there is some sort of surge and it kicks up that they then have some sort of muscle contraction or something like that, we don't want them to be driving or anything like that. Also, just making sure that they handle the machine properly. If we are giving them to use outside of clinic, we don't want them breaking it. We also don't want them changing the settings besides what we tell them that they can do. So our steps are really all the same as we even talked about with iontophoresis, and we'll continue the pre-application steps and all that through all of our different stims. So again, evaluating the injury properly, coming up with a proper diagnosis, setting goals with your patient, and then looking at the indications, contraindications, and everything of the various treatments and matching those to the goals. Asking the patient their pain scale or their patient-oriented outcomes, so we have some sort of baseline, checking the contraindications, checking the precautions, preparing the patient psychologically. So again, this is making sure that they understand the treatment, so that they explain what e-stim is, that you explain the level and how the e-stim is going to affect pain relief, so level 1, level 2, level 3, as well as explaining the sensations. So when we talk about the different levels, again, our level 1 is going to be more that pins and needles, your foot falling asleep kind of sensation. We don't want any motor contraction, no muscle contraction there. Level 2 is going to be the most intense. Remember, that's the pain inhibits pain. We probably don't want to sell it to our patient as pain inhibits pain, but that's going to be kind of the sensation. So those pins and needles are going to be much more intense, and our goal is going to be take them up as high as they can tolerate. If we end up with muscle contractions, that's fine. If we don't, that's fine. We just want to get them as high as they can tolerate. And then level 3 is going to be the pins and needles, but then we need to get to a muscle contraction. And once we get to the muscle contraction, we can take them wherever they want to be. We can stay just at that muscle contraction level. We can get more intense if they want that, and we can keep moving it up too as they accommodate. But we want to continue to see that. Also want to assure them that we're not going to electrocute them, right? Especially if you're doing the underwater stim, you need to reassure that process more. You can offer to demonstrate on yourself. Then it's preparing the patient physically. So checking for any open wounds, cleaning the area with the alcohol swabs, maybe shaving, maybe abrading the skin so that the pads stick well, making sure the person's comfortable. If the treatment's in a sensitive area, maybe the groin or up in the chest or shoulder area for a woman potentially, or glute region, we want to give them draping. So can we give them some privacy? That would be ideal. Or can we put a towel or a blanket over them so that they have some privacy and draping available. Then we prepare the equipment. So we turn it on, and then we're going to set our settings, and we'll talk about those individually. But that's going to be our duration, so our pulse duration or phase duration, as well as our pulse frequency or our pulse rate. So then before you kind of you can have some of those settings in place, get those in place, then we can get the pads on the individual, depending on what type of pads you're using. You can set up your pads in any of our arrangements, okay, the monopolar, the bipolar, the bifurcated. You can do the quadpolar setups, but they're not true IFC setups because it would be two different channels running, but you can do the cross or you can do the parallel. You want to make sure you have good contact with that. Then when we do the treatment, post-treatment, right, we turn off the machine, we remove and put the pads away, we check the area for any redness or burns or any other sort of irritation, do our pain scale or our patient-oriented outcome again to document that, give any instructions, start them on their next exercise or their next treatment, give them home and self treatment instructions, schedule their next treatment, tell them their level of participation, and then document all of that. And then again, our maintenance, we want to make sure that the machines are always clean, that the cords are always nice and in order and not frayed. If you're doing the portable units, you want to make sure that there's fresh batteries, that the pads are in working order. And then again, kind of daily things, cleaning the units, storing them neatly. If you're using sponges, you want to sanitize the sponges. So there's either usually a solution or you can actually get it wet and put it in the microwave for 2 minutes, and that will kill any bacteria. Monthly, you want to check all the leads, check all the cords, replace any electrodes, and annual calibration. So now let's actually talk about the different levels. So within TENS, we have really 3 to 4 different types of pain control that we can target. So the first one is our high rate. This is by far the most common one we use. This is going to be used for any painful condition. Okay, so this is our level 1 gate control theory. So we're trying to just stimulate those A beta fibers, right, like rubbing your elbow to block the pain. And so we can use it for something super acute, or it can be used in a chronic condition as well. You just got to remember that the treatment is really only working when the machine is on. So that's the only time you get the pain relief. So only during the application time. So again, we're trying to target those A beta fibers, our level 1 pain modulation. So review that if you need to, because you're going to have to be able to explain those pain levels. So our indications for this, painful conditions, especially when we wouldn't want a muscle contraction. So those very acute conditions, we wouldn't want any muscle contractions, which we're potentially getting with our level 2 and level 3. So this is really our only option for the really acute. We can use it in conjunction with RICE or PRICE or police or whatever word you want to use for that. It can be used post-operative pain management as well because of, again, because of the portability, someone can use it on their own. Someone can potentially wear this up to 24 hours. Again, they're going to accommodate, and so is that really all the most effective? But again, if we're trying to not use medications or things like that, this could be used. You can use any of your electrode setups, like I said, the monopolar, the bipolar, the bifurcated, or potentially quadpolar. It depends on what you want to target, how deep you want to go. So you need to make that decision based on the target tissue that you're setting up. And then when you set your parameters. So for our high rate TENS, our pulse duration kind of is going to be less than 100 microseconds. So we're trying to keep things really short, okay? In the duration. We call it high rate, or kind of higher frequency, high rate, because the pulse rate is very high, anywhere from 80 to 200 pulses per second. Some books will talk 60 to 120, some books will talk 60 to 100, some will have 100 to 200. So usually if you're somewhere in that range. And so once you finish this video and you get to start practicing on the machines, you'll actually do some activity that you change the pulse rate while the treatment's going, so you can kind of feel the differences between those different pulses. And there's no right answer to this. You have to pick these numbers kind of arbitrarily sometimes at first based on your experience from practicing where areas you like. but then also adapt them to your patient. So try a number. If the patient likes that, we can stick with that number. If they maybe need more or less, we can alter. If we're getting muscle contraction, we can change the duration and the pulse rate, things like that. Your amplitude, so that's going to be turning up the intensity, that is going to be low or submotor. So what we usually do is we start to turn it up and we tell our patient, okay, you're going to feel pins and needles. Tell me when you feel that. So they'll tell you when they start to feel that tingling, that pins and needles. And then you explain to them, okay, I'm going to turn this up and I want to take it as high as you can tolerate it, but I don't want any muscle contraction. So you start turning it up, and if they tell you to stop, you can stop there. And in a couple minutes, you'll check back and want to turn it up more, probably because they've probably accommodated. If they're not telling you that you need to stop, that they're fine with the intensity, and you start to see a muscle contraction form, a little muscle twitch, then you want to back down to that point right before the muscle twitch was happening. Now, if that sensation is so low that the person's like, I don't really, feel things, you're probably over a hyperstimulated area, like a motor point, and so maybe we change our pad. Or potentially you want to change and alter the pulse duration, because that will potentially affect how intense we can get the amplitude, right? Our pulse duration or our strength duration curve. Keep that in mind. So if we lower the duration, we can potentially increase up our amplitude a little bit more, or vice versa. Treatment time is theoretically 24 hours, but usually if we're doing treatment in clinic, we want this for about 30 minutes. Again, you only get treatment and you only get the pain relief while the machine is turned on. And so if someone's really acutely in pain, we'd like to give them as much pain relief as possible, so hopefully the body can break up that pain spasm cycle. So doing any less than 30 minutes is kind of It's what really is the goal of this. So usually, again, 30 minutes is best. So generally re-instruct the person if they have a portable device to use the device intermittently for 30-minute intervals. So again, if the stimulation is perceived over a really large area, so it's not really targeting the tissue you specifically want, you can potentially increase the pulse duration, and that will help shrink the area. If the stimulation is perceived as stronger than we really need, we can also try to decrease the pulse duration, and that might affect things. We can also adjust the electrodes, because again, maybe we're over one of those stimulation points, or we want to be over one of those stimulation points if we're not being able to get the results we want. So that's something that you can adjust as well. So our low rate TENS, this is going to target our level 3 pain control. Okay, so now we're trying to target those A delta fibers, maybe a little bit of the motor, the A alpha fibers, in order to get that muscle contraction. Because remember that as we move in the strength duration curve, everything below that level is also targeted. So when we do A betas, that's all we're targeting. No nerve fiber is below that. When we're targeting our A deltas, the A betas get felt, so the person's going to feel that pins and needle sensation just like they felt with the sensory, the gait control, the high rate TENS. They're also going to get those A alphas in the middle, which is where we get the muscle contraction. So in order to target those A deltas, everything else comes along with it. So it's a more vigorous form of treatment. So we tend not to use it in the most acute conditions. Because we're going to create that muscle contraction, we don't want to move that body part very much in a really acute inflammatory phase. So you want to use your 5 signs of inflammation in your pre-application steps to know if the person is in the inflammatory phase or more in the proliferation or maturation phase or in more of a chronic inflammatory phase. Because if they're in the really inflammatory phase, so again, kind of our first 24, 48, 72 hours usually, we wouldn't want muscle contractions because that would move the tissue, cause more disruption. It would also bring a lot of blood flow that we potentially don't need because we don't want the oxygen use to go up, right? The secondary cell death idea. So we wouldn't use this in kind of the most acute inflammatory conditions. And the goal is to stimulate and elicit that release of the androgynous opiates, our beta endorphins, so that we can get longer pain relief. So usually about 1 to 3 hours of pain relief after a 30-minute treatment. Now the person won't really start to feel the pain relief during the treatment. It will usually probably come right towards the end or even potentially after. So, you know, they might still feel their pain during the treatment. So indications, again, pain, but they have to be able to tolerate a muscle contraction, so that can't be contraindicated. It's used a lot in trigger points, in muscle spasms, because again, it helps break the pain spasm cycle, because the electrical signal kind of overrides the body's natural desire to spasm, because the electrical signal counters the action potential in those nerve fiber and those motor neurons. And so it can break up the pain spasm cycle like that. Again, we can use any of our pad setups. You have to base that based on the injury and the body type and the depth of the target tissue. And then when it comes to set our parameters. So now we want a really long pulse duration, okay, 200 to 500 microseconds. And then we want a really short pulse rate. So low, somewhere between 1 to 5. Some books say 2 to 10. So again, somewhere in that range you want to be. So 1 to 5 or 2 to 10. And again, arbitrary, we kind of pick a number to start with, and then you can adjust things based on what you find and what the patient needs and the best sensation for the patient. Then when it comes time to turn up the intensity, okay, we want to do that to the point of strong visible contractions, but they don't cause pain. So again, we're going to ask our patient, tell me when you feel pins and needles. They're going to tell us that. Then we're going to say, okay, I'm going to turn it up and I need to get to muscle contractions. So if it's too painful before I get to muscle contractions, let me know. And then we're probably going to have to change either our phase duration, or we're going to potentially have to move our pads around to get over more of a motor point so we get more stimulation. But if they're tolerating it, then we take them up to the point that we see muscle contraction, and then we want to go kind of as high as they can tolerate. So if they can tolerate the muscle contraction, keep turning it up until they tell you to stop. And again, treatment time is usually 30 minutes. In order to get that maximum pain relief after, we need at least a 30-minute treatment for that. Okay, our third type of TENS is our level 2 pain control, which is our brief intense. So again, this is our pain inhibits pain. We're trying to target our C fibers, which are way over on the right on our strength and duration curve. And again, kind of everything gets pulled along with it, okay? So we're trying to use the noxious stimuli in order to elicit pain relief through those descending pathways that we talked about. Ideally, we would use this with point stim, where we have a really small active electrode in the monopolar setup on a probe, and we can target trigger points in very specific areas for very short periods of time and then move on. Our machines, we don't have any probes, so we're going to use pads, pads of equal size. And we can still get to our level 2 pain control. It's just we need a little bit different settings than when we're using a probe. Okay. So you can use pads if you can get the pulse duration long enough. We need to be up over 300 microseconds, as high as we can really get our pulse duration. So we can't usually do it on a TENS unit. The pulse durations don't get high enough. So we really need to have a machine to do it. So our indications are pain conditions. Again, here's the kicker. We don't necessarily get muscle contractions, but we could. So there's some debate if we can use it acute, though if someone's in acute inflammatory condition, they're probably already kind of weary, and to cause them more pain is maybe not the best option. So we could use our level 1 for that. So again, it tends to end up being more subacute chronic situations. So our applications for our parameters, our pulse duration needs to be long, greater than 300 microseconds. Again, as long as we can get that. Our pulse rate, we want low. So 1 to 5 is if we were going to use point stim, okay? Or again, kind of 2 to 10, it varies. That would be if we have the probe. If we're going to use pads of equal size, so by a bipolar setup, we want to be in a 100 to 150 pulses per second. The amplitude is as high as tolerated. We literally need to go up. If we happen to get muscle contractions, we happen to get muscle contractions, but we need to go as high as they're going to tolerate. If we're using a probe, it's about 30 seconds per point. If we're using the pads, we're at less than a 10-minute treatment. So some people ask, like, why would I do this over doing level 3 when they both get you kind of that longer lasting pain relief? Reason being, this could be a quicker treatment. Okay, but again, they have to be able to tolerate that pain. If your machine has what's known as a VMS, variable muscle stimulation setting, that usually has the longest pulse duration available, so that's a good one to use if you're trying to do brief intense. Not a lot of machines have that, and so we just do our typical biphasic waveform. Okay, our final TENS is only done really on our TENS units. Okay, and this is what we call burst mode, and it's a form of modulation. So what we do is we can actually take the results of level 3. Okay, so we get level 3 pain control, but it ends up feeling more like level 1. I actually don't personally love it. I would rather just have level 3. I think level 3 feels fine, our low rate TENS, but some people really like this. And so it was developed to combine the efficacy of low rate TENS with a more comfortable sensation of high rate. And so the TENS unit itself puts out a high rate current, somewhere between 80 to 100 pulses per second. And then the machine, when we put it into burst mode, inherently modifies it into a duty cycle, so it comes out in bursts, a lot like our low rate TENS would come out in these like individual little pulses. So it gets packaged into however many bursts per second that we set. So the body really ends up perceiving the bursts, not the carrier frequency, but so we get the pain relief from those muscle contraction bursts, but we tend to feel more like of the pins and needles. But like I said, I'm not a huge fan of it. I would rather just do straight up low rate TENS. So the goal is to elicit those strong muscle contractions, but potentially at a lower intensity than you would need if you did low rate TENS. So application for this is, again, you have to have a certain TENS unit. When we're setting up our TENS units for our typical biphasic waveform, we'll show you this, you're usually on the C for continuous. Now we're going to move it to the B, which is for burst. And so we set our pulse duration at 100 to 200 microseconds, and then our pulse rate is, again, actually setting up the bursts per second. So the machine already is going to do that 80 to 100 pulses per second as the frequency, but now with the pulse rate gauge or the frequency gauge, we're going to actually set it and it becomes our burst per second. So we want to set that at 1 to 5 bursts per second. And you're looking for that strong visible contraction, so we need to take it up to the point of muscle contraction just like we would for level 3. Okay, so now is your time. You have one little kind of quiz that you have to do, and that lets me know that you know your parameters for these different TENS units or TENS waveforms, and then you get to now learn how to set all these up on our various machines.